you all so much for taking time out of your day to hear a little bit about Medicare. I'll admit, this is not the most exciting topic to listen to, but it is definitely very confusing. There's a lot of information, and the purpose of presenting today is really not to overwhelm you. It's just to simply educate you and provide some basic information that you need to know, and also to let you know that you have a resource here at HORAN when it comes to Medicare for any questions you have, if you need help enrolling. So before we jump in, I'll kind of give you a little explanation about kind of what our role is with Medicare, okay? So on the Medicare side, we are considered an independent broker. So I'm an independent insurance agent, and what that means is that we contract with about 10 or 11 different insurance companies, and when someone comes to us and they need help with Medicare, we help with the enrollment into Medicare, and then we will basically shop and compare all these different insurance companies and figure out which one fits your particular needs the best. And then we'll make a recommendation for you. And what's in it for us is that we actually are not allowed charging any fees at all. So there's no cost to get our help. We actually, because we contract with all these different insurance companies, when we help someone enroll, they actually pay us a commission because we stepped in and helped you out. It doesn't impact the cost of your plan, doesn't impact the benefits of your plan. So you're simply just getting our help with all this at no additional cost. And this is open literally to anybody who needs it. So we're a resource literally for, if you have any friends or family, or, if they're approaching age 65 and they're confused, they don't have anybody to help them, you're welcome to pass along our information as well, okay? So we'll jump right in here and get started. And when I'm done, at the very end, there's a little chat box with, you can type in a question. So I'll open up the lines and at the very end and address your questions, okay? All right, let's get started. Medicare, it was started in 1965, and it was designed, or it is designed for three groups of individuals. All right, the first group of individuals are those who qualify for Medicare based on their age. So you are eligible to start on Medicare, first eligible when you turn 65, and it's the birth month that you turn 65, and it actually is the first of that month. So if you turn 65 June 25th, you're able to start Medicare June 1st. Okay, so it always goes back up to the first of your birth month. If your birthday happens to fall on the first of the month, you are actually able to start it a month earlier. So if your birthday falls July 1st, you can start Medicare June 1st. So that's the only time where you can actually start it a month earlier is if your birthday happens to fall on the first. So that's your first group of individuals, qualified based on age. The second group of individuals are those of any age. So we have some clients in their 40s and 50s that are on Medicare because they are on Social Security disability. So once you're on Social Security disability for 24 months, you're actually automatically enrolled in Medicare on your 25th month. Okay, so that's your second group of individuals. The third group are, again, of any age. We don't see this too often, maybe once or twice a year, but we have individuals who are diagnosed with end-stage renal disease, that's permanent kidney failure, or ALS, Lou Gehrig's disease. So a diagnosis of either of those, you can actually qualify for Medicare at any age. All right, so those are your three groups, and there are four parts of Medicare, A, B, C, and D. So we're going to jump into those four parts here in a little bit, but just want to let you know the top two parts here, Part A and Part B, that is the government portion of Medicare. Okay, these are the only two parts that the government provides, is A and B. All right, the other parts, C and D, and there's another product called Medicare Supplement. These parts are through private health insurance companies. Okay, so Medicare is set up where part of it is through the government and the other part is through private health insurance. So as we go through this, I'll show you how they all work together. All right. Before we get into those four parts, there are a lot of rules with Medicare, and there's a lot of myths around those rules. So, if you ever try to do research on your own and try to figure out, your situation, what are the rules, it can quickly become overwhelming and confusing trying to figure this stuff out. Unfortunately, all the resources out there, it's tough to navigate. So here are some of the more common ones that we run into. So hopefully a couple of these will at least help clear up some confusion that you might have. All right. The first rule of Medicare, I hear this sometimes, is that a lot of people believe that when you hit age 65, everyone just automatically gets Medicare. That actually is true for some individuals, but it's not true for everybody. You'll actually hear me say that phrase a lot, that, this is true for these people, but not for everyone. So here's how this first myth works. So if you are collecting Social Security before the age of 65, so if you start collecting Social Security at 62, 63, 64, when you hit age 65, you are automatically enrolled in Medicare. Okay, so enrolling in Social Security will automatically enroll you in Medicare. However, if you are not collecting Social Security, when you reach age 65, you will not be enrolled in Medicare. That is up to you. If you want to be enrolled, then you have to physically fill out an application in order to get it. Okay, so it's automatic for some, but not everyone. The second one here, don't hear this too often anymore, but still an important one to know when it comes to Part A. So there are 3 different penalties in Medicare. This just talks about one of them. We'll talk about the other 2 a little bit later, but with Part A specifically, what this says is that as long as you or your spouse, either one of you, as long as either one of you have worked at least 10 years of your life paying Medicare taxes, there is no cost to Part A, and there's no penalty in delaying enrolling into Part A. Okay, so as long as you have that work history, which I'd say about 98% of the population has that at least 10 years under their belt paying Medicare taxes, or their spouse has. But most of the time, Part A, no cost, no penalty. Number 3, out of all these myths, this is the one I hear all day, every day, multiple times a day. So out of all the rules out there, this one's the most important in my opinion. Okay, the myth is that you have to sign up for Medicare at 65. Okay, that is true for some individuals, but it's not true for everybody. All right, so here are the rules that you need to know. If you have health insurance coverage through an employer, and this could be your employer or it could be a spouse's employer. So, okay, this counts for both, all right? As long as you have employer coverage, and as long as that employer has 20 or more employees, then you do not have to sign up for Medicare at 65. Okay, you are allowed to delay enrolling into Medicare until you're ready to come off of that employer plan, which for most folks is retirement. So I have some people I'm working with right now who they're getting ready to retire. They're approaching age 70. They haven't signed up for Medicare. They didn't when they turned 65, and they're going to be just fine. There is no penalty as long as you have that employer health insurance. Okay, so that's an important one. So if you don't have health insurance coverage through an employer, or if you're at an employer that's less than 20 employees, then yes, you do have to sign up for Medicare. Okay, so just depends on your personal situation. I talk to a lot of people, and they ask all their friends and family, what did they do? What did you, they get all this advice, and half of it's right and half of it's wrong because it just depends on your personal situation, what rule applies and what doesn't. So always important to talk to someone who lives and breathes this stuff every day, like myself and a few others here at HORAN. Okay, number 4. It's pretty much related to number 3, but you know, I've had calls from folks that say, you know, I'm turning 65 soon. I was talking to my boss, and they're telling me that I have to go on to Medicare, but I'm not eligible for the employer coverage anymore. And that's actually false. So, but there is a rule with this. And the same rule applies to the number of employees. So as long as you have coverage through your employer, and they have 20 or more employees, and as long as you're working the number of hours necessary to qualify for benefits at work, you're entitled to those benefits regardless of your age. Okay, so just because you hit age 65 doesn't mean you have to go on Medicare, and it doesn't mean that you're not eligible for your employer plan. You are eligible for that. There are age discrimination laws in the country that prevent that from happening. Okay, so you're entitled to keep that going, you know, basically as long as you want, as long as you're employed. All right, number 5, health savings accounts. There's a ton of rules, which results in a ton of confusion around this. So I'm going to go over a little bit here, and then we have 2 slides at the end that kind of dig a little deeper into HSAs. But the myth is that you can't have an HSA once you hit age 65. Okay, that's false. But again, it depends on your situation. So here's the rule. The rule says that, you know, let's talk about number 3 again. If we go back up to that, remember, you don't have to sign up for Medicare at 65 if you have health insurance coverage through your employer. But if you enroll in Medicare, Medicare says that as soon as you enroll into Medicare, if you're on an HSA plan, you can still stay on that plan. However, you can no longer put money into your HSA account, and your employer can't do that either. Okay, so if you enroll into Medicare when you hit age 65, no more contributions to that HSA. Okay, so you'll hear this advice from some people that says, oh, well, you know, when you turn 65, you should at least sign up for Part A because it's free. And that's true. There is no cost to Part A. And Part A, it will act as a secondary insurance plan to your employer plan for any hospital-related expenses. But whether you should sign up for Part A at 65 or not, it depends on what type of health plan you have. So my advice to people, it's different. It just depends on what type of health plan you have. So if you're turning age 65, if you're on an HSA, my advice, do not sign up for any part of Medicare. Delay all of it until you're ready to retire. But if you're not on an HSA, let's say you're on a more traditional health plan that has, I don't know, like copays for doctors and medications, you're on a more traditional plan, then there is no downside to enrolling in Part A of Medicare. So it just depends on your situation, whether you should do that or not. And again, we have a couple more slides at the end that kind of dig a little deeper into HSA. So we'll touch on that a little more. All right. All right, moving on, next slide. So we're going to dig into those 4 parts and kind of give you an overview of what that looks like. All right, so remember there are 2 parts that the government provides. All right, it's Part A and Part B. So we're looking at the first part here, Part A. As long as you have that work history, there is no monthly payment to Part A. It's $0 a month for that. Part A, all of your inpatient-related medical expenses roll up under Part A. So that includes if you get admitted into the hospital, a skilled nursing facility, or hospice. Now, one misunderstanding with Medicare is that they cover all of your expenses. I've heard that a lot. Well, Medicare covers it. Well, Medicare is designed to cover a portion of your expenses, leaving you responsible for a portion. Okay? So I'm going to show you what I'm talking about here. So this bullet point here that says how these services are covered, and we'll talk about just the first one here of if you get admitted into the hospital, inpatient into the hospital. Under Medicare Part A, so this is if you had Medicare just by itself and nothing else. Okay, so if you had Part A only, when you go into the hospital, you have a deductible that you're responsible for of $1,408. So you're responsible for that deductible. Medicare actually pays the rest. So if you go in for a surgery or something, you'll owe $1,408. Medicare pays the rest, which is good. I mean, when you're thinking about your medical bills and the deductible, I mean, $1,408 compared to a hospital bill is pretty good. However, that deductible is not a calendar year deductible that you're used to, okay? That is not a January through December deductible. They actually call that a benefit period, and it resets every 60 days. So let's say you go into the hospital and you have a surgery or something. You owe the $1,408 deductible. You get out of the hospital, and if 60 days go by, once you get out, 60 days go by, and then you happen to go into the hospital again, you'll owe another $1,408. Okay, so, you know, if you have a rough year and you have multiple trips in the hospital, there's a chance that you might owe that $1,408 multiple times throughout the year. Now, if you're in the hospital, let's say you're in the hospital for 60 days in a row, you know, God forbid that ever happens, but it does happen, and if you hit day 61, you'll not only owe the $1,408 for the first set of 60 days, but now, starting on day 61, it is a per day charge of $352 for each day that you're in there. You know, it's pretty rare you hit 90 days, but if you do, then they double it to $704 is your responsibility for each day that you're in there. So while Medicare, you know, the government portion of Medicare covers a portion, you know, you are responsible for a portion, and that is the purpose of having some type of health insurance plan in addition to Medicare to help cover some of these expenses. There are some plans that cover all of these expenses. So we're going to get into that here in a little bit when it comes to, you know, what your insurance options are. Okay, so that's Medicare Part A. Now the other part of Medicare is Part B. So when you're planning retirement and you're trying to figure out how much does Medicare cost, you know, what are you looking at in terms of a budget? This is the first monthly premium that you're going to write down, okay? So Part B comes with a monthly payment. The base premium is $144.60. That could be higher based on your income. So as a person who files their taxes single, the threshold is right around $87,000. So if you make less than $87,000, then you'll pay $144. If you're married filing jointly, it's like $174,000. So if you make less than that, then you just pay the $144. But if you're over those amounts, there's like 5 different income brackets above that, and you could potentially pay more for Part B. So that's an important part of figuring this stuff out, is exactly what you'll end up paying for B. So higher earners will pay more for Part B. All right. So, but for today's purposes, we'll just use the $144.60. All right. So that's your monthly payment. Keep in mind too, if you're collecting Social Security, that $144.60 will just automatically come out of your Social Security deposit every month. If you're not collecting Social Security when you go on Medicare, then they bill you. They send you a paper bill in the mail for that $144, but it's actually a quarterly bill. Okay, so you get a $144.60 times 3. That's your first bill, and they'll bill that every quarter. Okay, so remember back on Part A, that was all of your inpatient hospital expenses. Part B is everything outpatient, and there is a lot that rolls up under Part B of Medicare. So that's any kind of primary doctor visits, that's specialist doctor visits, if they run any tests, you know, that's medical equipment, that's ambulance, that's any kind of outpatient rehab or outpatient surgery. All that rolls up under Part B of Medicare. So just like Part A, Part B covers a portion of your expenses. You are responsible for a portion. Okay, so down here on this bullet point, it says, how are these services covered? I'll kind of walk you through how this works. So under Part B, you do have a deductible. It's very small, $198. And this one is calendar year. Okay, this one is a January through December. This is a one-time-a-year deductible. So you are responsible for the first $198 of your medical expenses. Once you meet that deductible, then for the remainder of the year, Medicare covers 80% of your expenses. You cover 20%. That's a pretty good chunk of expenses that Medicare is covering. They're covering 80%, which is good. The problem with the 20% that you're responsible for is that there is no limit. There is no cap. So if you had Medicare just by itself and nothing else, you're paying 20% of every medical expense that's under Part B. So every doctor visit, every test, chemotherapy, ambulance. You're paying 20% of every bill up to an unlimited amount. So we never advise folks to have Medicare just by itself. It's very important that you have Medicare, and then you will attach some type of insurance plan to help cover some of these expenses. Okay, and again, we're going to get into that here very soon. So that's the government portion of Medicare, Part A and Part B. All right, Medicare Card. The card here on the left, that's an old Medicare card. This Medicare claim number that you see with all zeros, that used to be your Social Security number. And they had your gender on there. And now, new cards, your Medicare number is now just a random 11 characters of numbers and letters. No gender. So when this card was being mailed, everyone got a replacement card, and took the government a whole year to mail everyone in the United States a brand new card. During that year, people were getting phone calls, and they were scams. The person on the other line would say, "Hey, as you know, we're mailing you your new insurance, new Medicare card. But in order to mail you a new one, we have to verify your information. Can you please provide your name and your address and your social?" And people were just giving out all of their information, thinking that's what they need to do to get a new card. And it was a scam the whole time. So part of this slide is just to kind of show you what a new card looks like and kind of the changes that they made. But another purpose of this slide is to let you know that anytime Medicare makes a change or there's an update, or there's always some type of scam attached to this. People are getting phone calls left and right. But just so you know, there's no government entity, including Medicare, Social Security, they never make any of these phone calls where they will ask you to provide your personal information over the phone. So occasionally they'll make phone calls, but it's more informative just to let you know, but they will never ask you for your personal information. So never give that over the phone to anybody claiming that they're from the government. Spread the word on that one. All right, roadmap. So when I have a sit-down one-on-one session with someone, and we're just trying to go over, once you're actually on Medicare, then what are your options? So now we're going to talk about the insurance options for Medicare. So, and I'll pull up the options down here, but I want to just talk real quickly here about Part A and Part B. So before you're able to do any insurance plan, okay, before you do any of these plans down here, the very first step in making this transition from your employer plan to Medicare, the very first step is applying for Medicare, because you can't enroll into any of these insurance plans until you have both Part A and Part B. All right? And you are allowed to apply for these parts once you're within 90 days of when you need it to start. So I'm talking to people right now that they plan on retiring at the end of the year, so they need Medicare to start January 1st. So the earliest they can actually fill out the Medicare application is once they're within the 90-day window, which is October 1st. So as you're planning this stuff, whatever date that you need, the earliest, just take that back 90 days, and that's the earliest you can start that process. So I do recommend that you start it as early as you possibly can. So as soon as you cross into that 90-day window, go ahead and fill out your Medicare application, get that going, because it usually takes about 2 or 3 weeks for Medicare to process that application. I've seen it take a month and a half. So earlier the better on this stuff. Try to get that turned in as quick as you can. And once it is finally approved, they will mail you a letter with your Medicare number. They'll eventually send you a Medicare card. And you can't sign up for any of those insurance plans until you get that Medicare number. So All right, so at the top of this roadmap, you have Part A and Part B, okay? So that's step one. And remember the costs that we just talked about, okay? So Part A, there is no monthly cost, but Part B is $144.60 a month. So whatever you do down here, whatever options you pick, you have to, you're always going to pay that $144.60. So that's a constant payment no matter what you do, okay? So now let's bring up the two options. So you have two main plans to choose from. You have Medicare Advantage plans. That's also referred to as Part C of Medicare, but we call them Medicare Advantage plans, or Medicare Supplement. You'll hear the term Medigap sometimes. We refer to them as Medicare Supplement plans. So, so you have these two options, Advantage or Supplement. Now I'm going to walk you through kind of the pros and cons of each one and kind of give you some idea on how much each of these cost and what they cover. All right. Let's start with Advantage. Okay, so with the Medicare Advantage plan, what's really attractive about an Advantage plan is the low monthly payment. Many of these Advantage plans actually are $0 per month. You actually don't have to pay a monthly payment on a lot of these Advantage plans, which is great. That's the positive. The trade-off, though, is that what you pay for is you pay for your medical expenses at the time they occur. So, for example, if you go into the doctor, usually it's in the form of a copay. So it's usually $5, $10, $15. If you need to see a specialist, it's usually $40 or $45 copay. If they run a test on you, there's a copay for that. If you go to the emergency room, it's a $90 copay. A day in the hospital is like a $350 copay for each day that you're in there. You know, every medical expense, doctor visit, hospital stay, surgery, tests, ambulance, I mean, there's always a portion that you are going to have to pay, copay or percentage. And just like the health plan that you have now, there is a limit on these plans. They call it your out-of-pocket maximum. Basically, that is the limit of how much you are responsible for in a year. Okay, so basically you keep paying copays and maybe a small percentage of all of your medical expenses, and if what you end up spending out of your pocket hits this limit, then you're covered 100% the rest of the year. Okay, so these limits are going to be, they're going to vary from one company to another, one plan to another, but most of them are going to fall somewhere between $4,000 and $6,000. Okay, so that's how these plans are designed. No monthly payment. You pay copays for your medical expenses throughout the year, and then if you ever hit that limit, somewhere between $4,000 and $6,000, then you're covered 100%. Okay. Now, one interesting part about these Advantage plans is that they actually replace Medicare as your primary insurance. So when you enroll into an Advantage plan, whatever insurance company you pick, let's say it's Anthem or Humana, United Healthcare, all these companies that are bombarding you in the mail every day trying to sell you something, they're the ones that take over. They're your only source of insurance. Medicare's cut out of it. You still have to pay for Part B of Medicare, but you're not using your Medicare card. You're just using your insurance card for everything: hospital, doctor, pharmacy. So because the insurance company takes over as your only source of insurance, you have to stay in that insurance company's network. So part of figuring out which Advantage plans you go with, it depends on your list of doctors and hospitals that are really important to you. So that's how we help people figure this stuff out. There's like 46 different Advantage plans to choose from. And what separates them apart from each other are several things, but network is one of them. So I'll get a list of your doctors and hospitals, and I'll look up each company and figure out which one has the most providers. Obviously, we're looking for a perfect match, looking for the company that has all of your providers in the network. But I just did one yesterday, and there was about 8 doctors I had to look up, and never found a perfect match. I went through all these different companies, and we kind of had to settle on the one that that had the most. So that's a very important aspect of this, is making sure that you are staying in the network on these Advantage plans. All right, Part D of Medicare. Okay, so Part D, D is in drugs. Part D of Medicare is automatically included in these Advantage plans, and many times at no additional cost. So you're using that card for co-pays for your medicine, doctor, hospital, all of it. So that's basically a crash course there in Advantage plans. So that's what we just went over here on the left. All right, and this date that you see down here, this October 15th through December 7th, that's the Medicare open enrollment period. So for anyone who's on an Advantage plan, this is your window of opportunity. If you wanted to, you could switch to another Advantage plan through another company. So if you sign up for, I don't know, United Healthcare Advantage plan, and then for whatever reason it's not working for you, and you want to switch to an Anthem or Humana or whoever, you can do that during this date, and then the switch occurs on January 1st. So you pick a plan during this time, and the switch occurs on January. All right, now switching gears over here to the other side of the roadmap is the Medicare Supplement option. Okay, this is option number 2. So I want to walk you through, some of the costs and the coverage and kind of the pros and cons here. There are about 10 different supplement plans to choose from. Okay, and basically a supplement plan is the exact opposite of an Advantage. So the concept here is that you will pay a higher monthly payment compared to Advantage. Remember, Advantage is 0. These are going to be higher. So, for example, there's a supplement plan that's the most commonly purchased supplement plan today. It's called Plan G. G is in girl. So Plan G, you are responsible for that Part B deductible. So if you go back to this Part B deductible, remember that is $198. Okay, so you cover the first $198 of your medical expenses. After that, that supplement Plan G picks up all medical expenses after that 100%. It picks up this remainder, this 20% that Medicare leaves you responsible for. Under Part A, all these co-pays, it picks all that up 100%. So when you enroll into Supplement Plan G, your maximum out of pocket, the most you can spend in a year, is just the $198 deductible. That's it. However, it comes with a monthly payment. So for Plan G, it's based off of age, it's based off of gender. Males, or any guys on the call here, sorry, we're a little more expensive when we get older. But when you hit age 65, the average cost of a Supplement Plan G right now is anywhere between like $105 to $120 a month, somewhere in that range. So you're paying that monthly payment in addition to paying the $144 for Part B, but your out-of-pocket expenses for medical expenses is only $198 for the year. Now, when you're enrolled into a supplement plan, again, you have a whole slew of insurance companies to choose from here, but it doesn't matter on the supplement plan what company you pick, because the supplement plans act as a secondary insurance plan to Medicare. So they don't replace it. They just simply act as a secondary coverage. So Medicare is your primary insurance when you enroll into a supplement plan. What that means is that the insurance companies don't determine your network of doctors and hospitals because they're secondary. Medicare being primary, what that means is that you can literally go to any doctor in the whole country, any hospital, any facility in the entire United States. As long as that provider accepts Medicare, then your supplement has to cover the expense. So I have some people that, we're on the border of, maybe they live in Kentucky, but they have doctors in Cincinnati that they want to see, or I've had people go to like Cleveland Clinic for cancer treatment or something like that, or people sometimes they want to go on vacation and they are spending time in Arizona or Florida or wherever, if something happens to you outside of your state, when you're on a supplement plan, you don't really have to worry about networks. You can go to anybody in the country that takes Medicare. A little more flexible. Now, Advantage plans, no matter where you're at in the country, you have to stay in the network. You have to stay in that insurance company's network. There are some out-of-network protections there. Like there's some plans that are PPOs, which are kind of nationwide networks. If you're on an HMO, there are no out-of-network benefits. So if something happens to you and you're out of the network, you're on your own. You're not covered. If it's a true like life-threatening emergency, then an HMO will cover you if you go out of the network. They don't penalize you for that, but that's network is something you really don't have to pay a whole lot of attention to on a supplement. See anybody you want that takes Medicare, which most do. All right, so you're paying that higher monthly payment, but much less out of your pocket. One drawback here to a supplement plan is that the drug coverage of Medicare Part D, it's not included in any supplement plan like it is on the Advantage. So it's a separate plan. That's why you see a separate column here. Separate column for Part D. So that comes with a separate monthly payment. And the average, it says down here, the national average is $32. In like Ohio, Kentucky, Indiana, average cost of a drug plan is right around $20 a month. But that is an additional monthly payment that you have to pay. And that would be in addition to your supplement premium, in addition to the Part B. So if you go the supplement route, you have $144 a month here. Let's just say like $110, $115 here, about $20 here. So this is the more expensive way to go, but the trade-off is very little out of your pocket in medical expenses. And the trade-off with an Advantage, as we've already talked about, is no monthly payment, but you have the risk of potentially paying out, maybe up to $5,000 a year if you have a rough year, a lot of medical expenses. So that's kind of the risk and reward with both options here. Now, I get this question a lot. You're probably thinking it now. Why can you just start with an Advantage and can you just switch over to a supplement later? Okay, the answer is maybe. It's not guaranteed. So this is a very important rule. So I know, eyes might be glazing over, might be checking your email or something, but this is a very important rule that I would encourage you to really take note of, all right? When you first enroll in Part B of Medicare, so this rule applies to the date that you start Part B, not the date that you start Part A, because these could be separate. You could enroll in Part A, and then you can enroll in B, a couple of years later. So it applies when you first get signed up for Part B. There is a window of time of 6 months from that date where you can enroll into any supplement plan through any company that you want, and it's guaranteed, meaning you don't have to qualify. You don't have to answer any health questions. Doesn't matter, healthy, sick. You pick any plan you want through any company you want, guaranteed enrollment. That only lasts 6 months from getting on B. Once you're past that 6-month period, in order to enroll into a supplement plan, now you do have to qualify based on your health. So what that means is that let's say you start with an Advantage plan, and then let's say a year or two goes by, and then you decide I want to switch over now to a supplement. Well, you're outside of that 6-month guaranteed window, so you're allowed to switch. However, now these insurance carriers, they're allowed now to ask you health questions. So what they're going to do is they're going to ask you, have you had a heart attack or stroke or cancer? Have you been in the hospital recently? Or have you been advised that you need to have surgery? What are the medications that you take? So they're going to basically ask you all those health questions, and then based on that, they will decide whether they will allow you to switch or not. So, there is a little bit of a risk and reward that way as well, that, I've seen it happen where you enroll into an Advantage plan, and then a couple years later, you get diagnosed with something or something happens, and then now you want to switch to a supplement. But now that something happened to you, it's too late. You cannot switch over to a supplement. But I've also had people that start with an Advantage, and, a couple of years go by, and they're like, yeah, I think it's time to, maybe switch over. and they're healthy still, and everything's fine. They're able to switch, no problem. But it just depends on your health at that point. So that's a little bit of a risk there. Now, if you start with a supplement and then later decide you want to go to an Advantage, they'll always let you make that move. So there is no health questions if you want to move from a supplement over to an Advantage. It's just going from Advantage to supplement. That's where, there's that requirement to qualify based on your health. Okay, so that's why you do not see that open enrollment date here, this October 15th through December 7th. That's why you do not see that here, because these supplement plans do not follow that open enrollment. There is no open enrollment for a supplement. It's basically that 6-month window after you get enrolled in the B. But you will notice it over here under Part D. So if you enroll into a supplement plan and you got your separate drug plan, there is that open enrollment date for Medicare for your drug plan. So if you start with a drug plan, and then, by the end of the year, let's say, you're on new medications, or maybe you're off some medications, and maybe the plan that you're on is not the best fit for you anymore. You have the opportunity to change your drug plan every year during that open enrollment period. So my job in all this is to help you navigate all this. So when you first get signed up for Medicare, we help you get enrolled. We help you kind of figure out, what's the best option for you, Advantage or supplement. We never steer you one way or the other. We simply just show you, here's what this side looks like, here's what this side looks like, and let you make that decision. And then every year during open enrollment, whichever side you're on, Advantage or supplement, every year we're a resource. We help you figure out, should you stay on your plan, should you switch it, and we kind of help you every year make that decision. All right, so that's what all your options kind of boil down to, is Advantage or supplement. I know that's just so much information I just laid out right there. So I apologize for the vast amount of information, but that's what it all boils down to. Here's a grid of all the different supplement plan options that you get to choose from. It's a crazy busy grid here. There's a lot of different supplement plans. I'm not going to go through each one of these, but I kind of highlighted 2 main plans, Plan G and Plan N. Those are the most commonly purchased supplement plans. Most of the time it's G. I'm not going to dive in too deep on this, but when this is over, we'll send out all the slides here so you can take a closer look at it. All right. All right. We only got, I think, 3 more slides to go, and then we're all done. All right. So the term donut hole. Have you ever heard that term before? It is kind of a slang term that's been around for about, 14, 15 years or so. What it refers to is the prescription coverage of Medicare. So I'm going to kind of walk you through how these prescription plans are structured. So this structure that you're looking at, this applies to every single drug plan in Medicare. So it doesn't matter if you enroll into an Advantage plan or if you enroll into a separate, like, standalone Part D drug plan. Whatever side you're on, it doesn't matter. This structure applies to both sides. Okay, so Medicare has put together this structure of how all plans have to operate. Okay, so and they basically break it up into 4 different stages. So you have a deductible stage, initial coverage period stage, coverage gap stage, aka donut hole, and then the final stage here at the bottom, catastrophic stage. All right. So the first stage, stage 1, is the deductible stage. So Medicare says that the standard deductible on your drug plan is $435. You'll see in parentheses here it says excluded on some plans. So there's a lot of leeway here with these drug plans. So some insurance companies don't even have a deductible. So they have the option to decide whether to include it or not. So you might have one, you might not. Sometimes they only apply it to, like, brand name drugs and not generics. So once you're through that deductible, or if you don't have one, then you go straight into this initial coverage period. So all that happens in this stage is that when you go to the pharmacy, you pick up your medications, you're paying a copay for your medication. All right. Now, every month, at the end of every month, you get a letter from your insurance company that says, they basically give you a summary of what medications you filled the previous month. So they'll say, okay, here's a list of all the medications that you filled in the month of May. And they'll list each one that you picked up, and they'll list what you paid for them. They'll say, okay, you paid $5 for this medication, you paid $20 for this one, and then they have a column right next to it that says, here's how much the insurance company paid for your medications. So they'll say, you paid $5 for this one, but the insurance company paid $25. You paid a $20 copay for this one, but they picked up $30 of it. So what they're doing is they're adding up what you're spending, and then they're adding up what the insurance company is spending, and they're keeping track of that total amount every month throughout the year. Now, if the total of what you're spending and the insurance company is spending, if that total ever reaches this number here, $4,020, you are now entered into the coverage gap stage or the donut hole stage for your medication. Now your copays go away, and now they're covered at a percentage. Now when you go to the pharmacy, the insurance picks up 75% of your medications. You pick up 25% of the cost. Usually when you hit this stage, what you're responsible for, what you're paying out of your pocket typically goes up. So you're paying 25% of brand name, 25% of generics. So you're paying 25%, so that means there's 75% left over. All right? Now, what they're doing is that the 75% that's left over, they're taking 70% of that dollar amount, and they're keeping track of that as well. That is going towards this number here, $6,350. So you hit the $4,020, you keep paying 25% of your medications, 70% of what's left over gets applied to this number here. So if you go from $4,020 up to $6,350, now you're out of the donut hole, and now you've hit the final stage, and you won't pay any more than 5% of your medications. Now your costs go way down. Crazy structure, right? Isn't that just wild? So this is by far the most confusing part of Medicare. So once we're done with this, we're home free. All right. So your experience in this drug plan is everybody's different. Your experience is just based on how many medications you're taking, how expensive they are. I see people like my grandma. She's 88, and she has never hit the donut hole in the 20-plus years she's been on Medicare. She's just one of the healthy people that have just been fortunate enough not to have anything really come up. She's never even touched any of this. Then I have some people that are 66, clients of mine, that are going to blow through this whole thing in like 4 or 5 months because their medications are just so expensive. And then some people, they're in this initial coverage period for 4 months. They're in the donut hole for 4 months, and then they're in the last stage for 4 months. It's kind of like a roller coaster. I will say most people don't hit the donut hole, but again, it just depends on your medications and how expensive they are and how many you have. So that's part of my job too, is that as you're making this transition to Medicare and you're trying to figure out, what is that going to look like? We have a little software on our computer. We plug in your medications, and it'll show us every single drug plan, every single Advantage plan. It'll show us which plan covers your medications the best. It'll tell us, if you are going to hit the donut hole, what month you're going to hit it, what your costs are going to look like. It'll show you if you're going to get out of the donut hole, what month you're going to have to get out of the donut hole. So when I do all this, we pretty much lay out everything that you need to know, all the numbers, so there's no surprises when you enroll into a plan, what to expect. Okay, so that's how the drug coverage and the term donut hole, where that comes from. So that covers the drug plan, and now, I totally lied. Now there's 3 slides. All right, we talked about penalties, all right, at the beginning, right? So there are 2 penalties left in Medicare that we haven't talked about. It's the Part B penalty and Part D penalty, okay? the Part B penalty is not on this slide because it basically is what we already talked about at the beginning. As long as you have health insurance coverage through your employer, or if you're a spouse on your employer, spouse's employer, as long as that company has 20 or more employees, you don't have to enroll in the Part B of Medicare at 65. You can delay it without a Part B penalty, okay? So don't worry about the Part B penalty as long as you have that employer coverage. However, Part D penalty goes one step further. The Part D penalty says that that if you have health insurance coverage through your employer, it has to be good enough according to Medicare standards. So the term that they use is called creditable. Okay, your employer plan has to be deemed creditable in the eyes of Medicare. Okay, so there's basically I'm not sure exactly how they figure that out, but there's some sort of calculation on how your plan covers medications, and then depending on how that is deemed, your plan is either deemed credible or non-credible. Now, your employer, every year during your employer's open enrollment period where you get to elect what plan you want to be on, they have to send you a notice to let you know if your plan is considered creditable or non-creditable. If it is credible, then you're fine. You will not be hit with the Part D penalty, and you don't have to worry about this at all. If it's non-creditable, which is actually rare, we don't see it too often, but definitely ask your employer if you're on a credible or non-creditable health plan. Now, if you're on a non-credible health plan, I'm not going to go through all these calculations and everything. I'll just tell you that if you find out you're on a non-credible health plan, give me a call and I'll walk you through kind of some strategies involved with how to avoid paying that penalty. Right? We're running a little short on time, so I want to make sure that we get to these last slides and have enough time for Q&A. All right, HSAs, last two slides here. We kind of talked about some of this stuff already, but just keep in mind, looking at the top bullet point here, that enrolling into Social Security automatically triggers that enrollment into Medicare. So, as you're working with financial advisors, or you're trying to figure out when to start drawing Social Security, you hear from a lot of advisors that the best time to do it, well, it's up to you. I'm not an expert in that area, but if you start collecting Social Security at your full retirement age, which for most people is 66 or maybe 66 in a few months, just remember that you're going to be automatically enrolled in Medicare, which means if you are enrolled in Medicare, remember the rule is that you cannot put money into your HSA now that you're enrolled in Medicare. So it's a bit of a domino effect of enrolling in Social Security. That triggers automatic enrollment in Medicare, which means you can't put money in your HSA. So keep that in mind as you're trying to figure out when to draw Social Security. If you're still working and you're on an HSA and you want to keep putting in there, it might make sense to put off Social Security till a later date. All right, now once you hit age 65, if you have money sitting into that HSA, if you take it out for something other than a qualified medical expense, and let's say you use it you want to buy a boat or go on vacation or something, there's no more penalty for taking that out. You do have to pay taxes on it, but there's no more 20% penalty for taking it out for a non-medical expense. Here are the limits that you can contribute into that account. As a single, it's $3,550. As a family, it's $7,100. If you're over the age of 55, you can add $1,000 to each of these columns. That's the most you can put in. Next year, they're bumping this one up $50 and the family up $100. All right, so let me go back. There we go. So this last bullet point here. So this rule that I've been telling you about, that if you sign up for Part A of Medicare, you can't put money into your account, that rule only applies to the employee. It does not apply to the spouse. Okay, so let's say your spouse is maybe older than you and decides that they want to start drawing Social Security. They'll get automatically enrolled in Medicare. and it does not impact your plan, your health plan. You can still put money into your HSA. You can still contribute up to the family maximum. You can still use the money for your spouse's expenses, okay? So this enrollment into Medicare, it only impacts your HSA if it's the employee that enrolls into Medicare, not the spouse. All right, so keep that in mind. All right. Now, if you have money in your HSA when you get on Medicare, you can use that money that's in there for your Medicare expenses. So that Part B premium, that $144.60 that we talked about, the drug plan. There are some Medicare Advantage plans that do have a monthly payment. Sometimes they have, enriched benefits, so they charge you a little more for it. You can use all that HSA money for all those expenses. So a lot of people are using this as like a little mini retirement account. And if you're able to put money in there, it goes in tax-free, it comes out tax-free, and you can use it for your Medicare expenses in retirement. The only thing you can't use it for, and I don't know why, but the only thing you can't use it for is that if you enroll into a Medicare Supplement plan, the monthly cost of that, you can't use your HSA for. You can use it for your deductible, but not your monthly payment. Okay, last goofy rule here with Medicare, and then we're all done. All right, and this applies to you if you are enrolling into Medicare after age 65. So if you enroll like at 66, 67, 70, whatever, after you turn 65, let's say you keep working and you retire at 68, then you decide to sign up for Medicare. So like, for example, I have people retiring at the end of the year right now. They're planning this out, and they're trying to enroll into Medicare as of January 1st. What's going to happen is that when they sign up for Part A and Part B, Medicare will start Part B January 1st for them. But they're going to retroactively start Part A back 6 months. Okay, so Part A always goes back 6 months. Why do they do that, right? Well, it was originally intended as a benefit because Medicare will retroactively cover any hospital expenses you had going back 6 months. Might help you, might not. But remember, the rule is that if you are enrolled in Medicare, you can't put money in your HSA. So because they take that Part A back 6 months, what does that mean? That means that you have to stop putting money in your HSA 6 months before you plan on signing up for Medicare. Who comes up with this stuff? So as you're planning retirement, as you're planning on signing up for Medicare, if you're on an HSA, call me, and what we do is basically help you put a timeline together. And we'll say, as of this date, make sure you stop putting money in your HSA. As of this date, make sure you enroll into Medicare. So we can kind of help you, put that timeline together. Now, it's happening right now where, unfortunately, some people don't have the luxury of planning 6 months in advance. Sometimes, you get furloughed or the layoff happens suddenly, and you're not able to plan that far ahead. So what happens? So they're going to take Part A back 6 months, and any HSA contributions you had during that 6 month window, you simply have to pay taxes on it. So it's not the end of the world, and it's not the whole balance in your HSA. It's just whatever's been put in during that 6 month window. It's basically no longer tax sheltered. So you can work with your employer to withdraw that money. They'll take that out, and that way you don't have to worry about any headaches come tax time. Okay, is that enough for today? You guys all had enough? That is it. And the final page here is just a list of resources. Here's my information in the top left. One of my colleagues here, Heather Blue, her contact information there as well. She also is an expert in folks who are not yet age 65 who needs help finding their own individual health plan. And I do that as well, but she does that too. So if you have any questions about that or need any help with that, either one of us can help you there. And that's it. Thank you so much for hanging on. I'm going to go to this Q&A here. Mimi, yes, we'll get you a copy of the slide deck. Let's see. Mimi, you asked, are more doctors opting out of Medicare due to low reimbursement? I've heard that. definitely have heard that. I can I can tell you that we're right around like 93% of the doctors in the country take Medicare. So, well, that does mean that there's 7% that don't. So it's always important that anytime you are on Medicare, if you're having to visit a specialist or a doctor, that is a question that you have to ask: is do you accept Medicare? But we're still looking really good. I mean, you got the boomer generation coming on. I mean, you got a lot of enrollees in Medicare. So if a doctor opts out of that, they're basically missing out on a vast population. Jim, do any of these plans cover hearing aids? So Medicare Advantage plans, most of them. Okay, thanks, Pam. Thanks for joining. Jim, hearing aids. So there are some Advantage plans that have some hearing aid coverage on there. Supplement plans do not cover that at all. So that would be something you have to purchase on your own. But the Advantage plans that cover them, they don't cover all of it. They will basically give you a copay, and it's usually high. I mean, as you know, hearing aids are expensive, so they'll have a copay of like, $700 copay for a basic pair, or a $1,000 copay for like a premium pair. Which seems like a lot, but the actual costs are thousands and thousands of dollars. So there's usually some coverage there on an Advantage plan. Andrea, we're in New Mexico. Can you still advise as to supplement plans? So we are personally licensed in Ohio and Kentucky and Indiana, Virginia, Florida, Colorado. I know that seems kind of random of those states, but we're not licensed in New Mexico. Everything that I went over as far as Medicare goes applies to every state. I would encourage you that if you are a resident of New Mexico, you would try to find an independent insurance agent like myself nearby, someone who is contracted with numerous health insurance companies that have no bias, or they're not married to any particular insurance company. If you get advice from an agent and they tell you that, go with this plan or go with that plan, or if you ever need like a second opinion, I'm not licensed in New Mexico, but I can pretty much tell pretty quickly if someone's giving you proper advice on what your needs are versus what they're presenting to you. So you can always use me as a backup to make sure you're getting honest advice. But find an independent Medicare agent. Just Google that. Independent Medicare agent in whatever city you're in Mexico. All right? Any other questions? I think I covered them all. Well, you got my contact information. We'll send it out in the deck. And then any other questions you have, you're always welcome to reach out. Call me, email me anytime. Thank you so much for joining, and we'll end the call now. And have a great rest of your day. Thanks.